First of all, thank you for coming to this event, and it's great to see all these healthcare leaders and innovators and be at the Capitol Factory House. I mean, this place is just brimming with innovation and new ideas. And so to be clear, Babson Diagnostics developed BetterWay, so that's the connection. That's our main focus. And Eric Olson, who's here in the audience, back there waving his hand, is the company's founder, and Babson has a great team. But this is really a 10-year story. It's literally taken the company a full decade to develop this technology and get it fully validated. And so we're going to have a panel here, and I'll introduce Gabby and Fred Turner, the CEO of Curative, in a moment. But just to frame it, we're going to talk about the patient experience and the role of blood testing in it. And to put it in perspective, as Kim mentioned, I've spent the last 20 years in the ambulatory care space, and what I've seen is that healthcare has consistently moved away from the hospital into the community, and in all sorts of different ways, as I'm sure you've experienced. And that is a great step in terms of patient experience, because it's made routine care and increasingly not so routine care much more accessible to people. So that's an important part of the patient experience, but it's not the only part. And so another part of the patient experience that's very fundamental is blood testing. So 70% of medical decisions are based on blood testing, and yet the collection process is basically not changed in 75 years. And there are a lot of patients who don't like to have a needle stuck in their arm. And if you look at the data, so in a recent survey, 80% of patients or respondents said they had some level of anxiety about getting their blood tested. 1 in 4 has needle phobia. Half of needle sticks need to be done more than once in order to get a usable sample. The result of that is that nearly a third of patients are non-adherent to testing, for a combination of reasons, but, needle anxiety being one of them. And so along comes BetterWay. And, I really do believe that we are the first company that's developed a viable alternative to venipuncture that's been fully validated. So the results have been proven to be clinically equivalent to conventional methods. And we have a large menu of tests. So this is not just a point of care test. We have a couple of tests. We have 68 tests now covering more than 80% of what's normally ordered in a primary care setting. So we're obviously really excited about it, and it's part of the patient experience. And so let me introduce my two co-panelists, if you will. So Gabby Thomas, please, come over, and Fred Turner. So let me introduce, first of all, Gabby, who does have a very unusual badge here that just says Olympian. And actually, the backstory is, for those of you who don't know, not only is she an Olympian, but she won 3 gold medals at the last Olympics in Paris, and I think you plan to compete in LA in 28. So that's pretty amazing. What's also very important to us, and we've partnered with Gabby on BetterWay, is that she's a very committed healthcare advocate. And has a neuroscience degree from Harvard and a master's in epidemiology from the University of Texas. She's an Austinite, and has done a tremendous amount of volunteer work in Austin, particularly focused on underinsured and uninsured populations. And so, Gabby, it's great to see you again, as always, and thank you for being a patient tonight. We're all patients, right? And Fred Turner is the CEO and co-founder of Curative. He was educated in Oxford and came to the States, I think, initially in California, and then saw the light and moved to Austin about 4 years ago. Is that correct?
Yeah, I was always aiming for Texas. I just overshot.
So, right. Yeah, good point. And so Curative started out as a company that played a major role in enabling patients to get COVID tests during the pandemic. I think 36 million tests across 40 states. So, very significant, played a very significant part in helping us deal with that, tragic and very difficult episode. But more recently, 4 years ago, introduced a very innovative employer-sponsored health plan, which basically waives all out-of-pocket costs for any members who get what you call a
Baseline visit.
baseline visit within 120 days of enrollment. So obviously, blood testing plays a role there. So anyway, welcome to the panel. And so, Gabby, let me start with you. In your role as a professional athlete, you obviously do a lot of blood testing.
Yes.
And so maybe talk a little bit about what blood testing means to you, both professionally and personally.
Yeah. A lot of people probably don't know that, so that actually is a fun fact. A big part of our training is keeping up with our blood testing. USA Track and Field does actually send us a lab slip twice a year that we're supposed to go get done, right? A lot of times, the athletes don't end up doing that, and you can imagine why. I even invited one of my teammates actually to come here, and her response was, "Ooh, I don't like needles." And I was like, that's the whole point. That's the point of why we're here. But a big part of what we do as elite athletes at the pro level is really owning and mastering the basics. So it's these routine things that you can do every day, these things that are sustainable, like your diet and nutrition, like getting 8 hours of sleep at minimum. These really small things, stretching every day, making sure you're warming up properly. So it's mastering these really small things, but that most people tend not to focus on or focus on mastering. And getting blood testing is a part of that. Now, the issue with blood testing is that typically, it's inconvenient, right? You have to plan ahead and go somewhere and then have this IV stuck inside of you, which is very intimidating for a lot of people. So anytime that you can take a task that you need to accomplish at our level and just make it convenient, make it fit into your daily life, make it fit into your routine, that changes everything. And when we're talking about truly the difference between a gold medal at the Olympics and not being at the Olympics is a fraction of a second. It's maybe 0.2 seconds, which you can't even you can't even, it's like blinking. And those slight differences are they come into play by how you take care of yourself. And so routine blood testing for me is a big part of that. I do the CBC panel. I like to see how oxygen is moving through my muscles. I do the vitamin D just for everything, right? Vitamin D for recovery, for muscle, for power output. I do so many different metrics that make a big difference. And even in 2024, when I was training for the Olympics, I did get some adverse blood findings that I had to adjust and tailor my training accordingly right before the Olympic trials due to those results. And that I do believe it made a big difference, because otherwise I'm not sure where I would have been. I definitely wouldn't have 3 gold medals. So it's something that I do incorporate into my daily life. And anyone who's serious at our elite level, will make that the priority. But it's also really important for my overall health.
Yeah, no, great answer. And obviously, very fundamental to your personal life as well as your professional one.
Yeah.
So, Fred, tell us a little bit. You've introduced this very innovative health plan, which is obviously it's very preventive care oriented. So, tell us a little bit about it, if you would.
Yeah, so a big part of this came out of during the pandemic. We were kind of working with every insurance company and also a big customer of insurance, trying to buy health coverage for 7,000 people across the US. And we were never happy with the solutions that we could get for our employees. Everything seemed like the goal was, let's just drive people to skip care. Let's put up as many barriers. Let's put up walls. Let's put in deductibles, copays, and just make everything really hard. And that does save money if you're trying to just save money over 12 months. People just stop getting care. It's a good short-term trick, but it doesn't work long-term. That's not the right way to treat people's health. It's not the right way to deal with your employees. What ends up happening is people just get disillusioned with healthcare. They disengage. They stop going to see their doctor. They stop doing blood work. And then problems compound and get worse and worse, and eventually they end up needing a much higher level of care that was probably avoided. And so with Curative, we tried to design basically the complete opposite of that. And so all of our members start out the year with basically $0 out of pocket, everything's covered, everything's free, and you get 120 days to show up and do what we call the baseline visit. So it's a mix of an onboarding to the plan where we actually explain health insurance, make it less confusing, explain what you should be doing about your health, and then 30 minutes with a clinician, basically making a plan for what should you do this year to manage your healthcare better. A big part of that is obviously lab testing. We send out labs beforehand. And for a lot of members, it might be the first time in years or sometimes even ever that they've gone and gotten their blood work done. And so it kind of creates that opportunity where you're removing those barriers. And we find a lot of stuff. We find a lot of issues, but it gives us that opportunity to engage people as early as possible and try and help manage through those issues and get them healthier. We've shown over the first about 4 years now, when we get members on the plan, we reduce the chance of them getting hospitalized by about 40%. Within the first year, we reduced the drug spend by about 45%. And so, surprise, surprise, preventative health works. If you actually take care of yourself, it is a good idea. And people stay healthier because of it.
Yeah, and that's incredible data and a great philosophy. So it's basically, it's good for the patient and good for the payer.
Yeah, literally everybody wins.
Yeah, that's good. Rare in healthcare, but that's a tremendous accomplishment. And so that sort of brings up the whole question of the baseline and how important the baseline is. So Gabby, what's your perspective on that?
Well, the baseline is important because your normal is normal for you, and it might look different from everybody else's. And I think that's really important to remember. The importance of having routine testing and doing it over the course of a time and having it be kind of this process is you realize what your baseline is, and then you can see when you're deviating from it, and you can start to kind of piece together this picture of your own health journey, of your own health record. And when you know yourself and know your body and you're confident in that you feel a lot more empowered in making health choices. You're more informed, and I think that's also really why I like the piece of what you're doing when you're talking to the patients and letting them know what they can be doing and what they should be doing and how they can be doing it. Because a lot of it is just about being informed and having that confidence and knowing what steps to take next. So I know what my baseline is for certain blood tests, and when I am in a really heavy training load, I might do a test and kind of see, okay, this is abnormal, but it's because I'm training really hard right now, or this is too much. Like something I do test is the creatine kinase, so I can see, am I overworking? Am I overtraining right now? Am I at risk for being injured? But then also looking at something simple like a lipid panel, so I can see, am I okay right now? Are there any things that I need to do and be more proactive on so that I can make sure that I'm taking the best control of my health?
Yeah, that makes perfect sense. So, Fred, you do this baseline visit, and then how do you keep your members engaged?
Yeah, so you're absolutely right. That's basically just the start. Engagement is great, but then you got to continue that. We want people to not just have, do the blood test once, not just come in and think about it once, but keep thinking about that. So we partner all of our members with a care navigator. They're basically your guide through the healthcare system. You can text them, call them, email them, and they are there to basically help them through the system. It's gotten so complicated. Unfortunately, healthcare, there's, so many different things to figure out, places to go, that people kind of need that additional help, guidance, so that they can reach out to somebody that's on their side, advocating for them and saying, yeah, here's where you should go. Here's the place with the best quality scores. Here's the place that is best for you to deal with as an issue. Sometimes they'll even call up and make appointments on behalf of members, because a lot of the reasons why people don't engage, they end up being silly things like, oh, I was just really busy at work the last week, and that's why I didn't call up and make the colonoscopy appointment. And those missed appointments, they end up compounding over time. So just having that assistance to really work through those things with members and help them get that care makes a big difference.
Removing some of the barriers to blood testing obviously is one. What are some of the others that are really important to success in terms of keeping people engaged.
Yeah, I think primary care is the foundation of a lot of this. We find when members join our plan, it's about 50-50, whether people say that they have primary care, and then of the ones who say they have primary care, maybe another 50-50. Do they actually have primary care? Just because you know the name of a doctor you saw 3 years ago, it's not the same thing as primary care.
Great.
But establishing that relationship, with a physician, so you know where to go if there's an issue. So many, doctors' offices, medical groups have telemedicine set up now, provide that free of charge for members as well. You just hit the button, you're talking to a doctor. So really getting them kind of set up in the system, go and get that physical, go and establish that care so that if you need it later on, you're in that kind of regular cadence. A lot of it is literally just nagging people, saying, hey, we talked about this last year at baseline visit, we're here again the next year. Care navigate is texting and just trying to remove as no barriers as possible. I think it's kind of the opposite of the traditional payer philosophy, which is you should avoid as much care as possible because that's spent. You got to view a dollar differently. Like
Turning the paradigm really upside down.
Yeah, a dollar spent on primary care, lab tested, preventative care is far more valuable than a dollar spent in the hospital. And you got to view it that way, then you end up driving better outcomes.
So, Gabby, do your Olympian friends feel the same way that you do? I mean, do they have somewhat the same philosophy that you have to pay very close attention?
Yes, I would say so. Anyone who has success at my level does, because they are tracking these little things. They're tracking their, like I said before, they're mastering the basics. But that being said, you don't have to be an Olympian to take control of your health and to get blood testing and really track like Gabby. One thing that I kind of thought of when you were speaking is my volunteer work at the healthcare clinic in Austin. The majority of my role was actually keeping in contact with these patients and making sure that they knew what to do, how to do it. And a lot of the time it really was reminding them to do it, because life does get in the way. It was maybe driving over to their house and knocking on their door and giving them what they need, or if it was calling and texting, and just making it as easy as possible, because the truth is people are really busy. And as an Olympian, it is our job to stay healthy. So that does make it a little bit easier, because our entire job kind of banks on taking care of our body. But we also get really busy too. So the key is to really meet people where they're at. And when you can do that and make it as convenient as possible, then it's helpful. And so even Olympians, we need that too. We have our doctors from USA Track and Field checking in, calling us, texting us, like, have you done this? Have you completed that? And it's quite literally our job.
I think that the convenience part is obviously very important. So I think, Kim, you may have mentioned this, but we're partnering with HEB and Sam's Club pharmacies here. So we have 25 locations, and we expect that we're going to have more provider organizations deploy BetterWay. But part of that is, making it convenient, and removing the needle-related barriers to testing. And I think, this is really all about transforming the system from, we call it a healthcare system, but my view is it's always been really more of a sick care system. And we've got to change that. So have any thoughts on that subject?
Yeah, I think so many of the dollars today end up going on that later stage care for things that could have been prevented further upstream. And it's easy, if you're managing a health plan, every day you're looking at these $500,000 hospital bills. It's easy to not be looking at, it's $2 for this lab test. Like, if we invest more in that kind of thing, you can meaningfully impact the rate of the higher acuity things that end up happening in the population. And so you've got to kind of not lose the wood for the trees, so to speak, that you're actually focusing on getting members to engage, getting them to the right care. And then we see that the data, you can avoid a lot of that downstream care. The other thing is just access in general. I think because it's gotten so complicated, there's so many rules put on healthcare, network, non-network. We try and kind of remove as many of those barriers as possible. We give our members a credit card. It's a Visa credit card. You can go and use it to just pay the cash price for care at over 1 million places nationwide. So you're not having to check, what is the status of this? Is this one in network? Is this one not in network? Everybody takes Visa, so you could just show up, not worry about that. And we want people worrying more about their health and more about managing that and less about how it's being paid for.
Yeah, removing the financial barriers as well. So that's great stuff. And if you want to learn more about Track Like Gabby, go to tracklikegabby.com, about the importance of blood testing. Want to learn more about Curative and BetterWay, we have tables over there. But most of all, enjoy yourselves this evening. Thank you, Gabby. Thank you, Fred. And, thanks again, everybody, for coming.